Okay, I see it's one after. So, hello everyone, and welcome to today's Advocacy Insights webinar. My name is Heather Folker, and I'm with NEHA. I'm so glad that you're here today. Today, Doug Farquhar, NEHA's Director of Government Affairs, will guide us through key policy updates impacting environmental health professionals. Throughout today's session, feel free to post your questions in the chat. We'll do our best to answer those during the Q&A session at the end. So with that, I will turn it over to Doug.
Heather, thank you very much. I appreciate that introduction. We have a lot to go over today. We have received the release of the potential HHS budget for fiscal year 26, which is going to cover a lot. But before we get to that, let me turn on the PowerPoint, and I believe we're there. And Heather, please let me know if you can't see the PowerPoint there.
I can see it just fine.
Okay, that sounds great. For Advocacy Insights for the month, we've got a lot of things to cover. It's been not only a busy month, but a lot of chaos going on. As I've said and always said, environmental health is primarily state and local. This is where 90% of the funding comes from. This is where 90% of the activities come from. But we've seen a dramatic shift this month with the elimination of the National Center for Environmental Health and changes to the FDA Human Foods Program, which is really going to fundamentally restructure the way environmental health is going to be practiced in this country. When you look at environmental health, granted, it's the state and locals. They're going to be the ones that do the retail food safety. They're the ones that are going to do the inspections of the manufacture of food. They're the ones who are going to be doing the body art. They're the ones who are going to be doing the CBDs and what's going on there. But the federal government has a huge role to play in all that, and that is what is getting cut. We got to remember, federal budget is close to a third of the entire economy. So anytime you take that, you are taking huge chunks of the economy out of the system, which puts huge pressures on on other parts of the economy to either step up or make sure nothing happens, or or it just goes away. Where do we stand right now? We still are in the same place we were really in a lot of respects than a month ago. The 119th Congress has not passed the fiscal year 2025 budget. They passed a continuing resolution. They didn't come up with a series of numbers that they agreed to. They just said, we're just going to continue the fiscal year 24 budget, which came into the fiscal year 25 budget. Now it's been a continuing resolution all the way till September. So technically, we will never see a fiscal year 25 budget. We will see a fiscal year 26 budget. That is going to have to come out, or technically, fiscal year 26 is going to start in October. As many of you know, that's 6 months away, and they haven't even started. So it's going to be a challenge. If that was the only challenge Congress had to deal with, that would be pretty significant. But they also want to pass the reconciliation budget. The reconciliation budget is going to allow them to pass the Trump legislative agenda. Why are they going that path? Well, because even though they have a majority in the House, they do not have the 60-vote threshold that they need to pass any new bills in the Senate, with the exception of budgetary acts, which can be done via reconciliation. So therefore, they are trying to say, okay, we want to put all these programs that Trump wants to do, the border security, increases to defense, dealing with the immigration issue, the Trump tax cuts, which expire in December. They want to put this all in a single reconciliation budget, which would require only a simple majority in the Senate. That is phenomenally huge challenge to do. If you remember, under Obama, he was trying to get the Obamacare passed. And with the death of Senator Kennedy from Massachusetts, they didn't have the votes available. They only had 59 votes. They didn't have the 60 votes needed in the Senate. What happened is they used reconciliation. They said it was a tax. They said it could be put through reconciliation. So therefore, they needed a simple majority, not the 60 vote threshold. With that, we still are in a similar situation now. We keep on hearing it pushed back. Trump originally wanted it on his desk by April. Now they're saying by Memorial Day. There are certain things that they have done. The House and Senate did agree on certain numbers to move forward with reconciliation, but they haven't really done the tough issues, meaning how are they going to come up with 1.5 trillion in budget cuts? How are they going to come up with the 4 trillion that they talked about in budget cuts for the House side? How are they going to agree that the Trump tax cuts do not add to the budget? If they say that, if the parliamentarian says that's okay, then they got a whole different set of figures to work with. They got a lot more. Their budget deficit is much smaller. If the parliamentarian says no, you can't do that. That's ridiculous. Then it's going to be much tighter, and it's going to really have to go after the budgets and the programs that are very popular in this country: defense, Medicaid, Medicare, Social Security. These are all things that are fundamental to many constituencies in this country. And even non-defense discretionary funding, which funds all of FDA, CDC, HHS, USDA, Transportation, Department of Energy, EPA, all those programs. Well, all those programs equal to the Department of Defense budget. If you start fussing with the non-defense, that means you're going to have to be going after USDA funds, the 40 to 60 billion that we give to farmers every year, so they can stay afloat. The money we give for roads and transportation, money we give for highways, money out there for food safety, money out there for egg safety, money out there for international trade, money out there for NASA. All these programs that are popular, but they aren't big ticket items. They're very small ticket items. I think I mentioned last time, and I'll mention it again, the difference between what they're proposing for USDA between 80 billion and 100 billion. In that $20 billion a gap, they could fund all of CDC at Biden levels and all of EPA at Biden levels. Within both those programs is within the wiggle room, within the gap that they're negotiating right now for USDA. So all these programs that people have talked about, let's get rid of, let's eliminate, you got to remember, they don't account for much. The big programs: Social Security, Medicaid, Medicare, defense. Think about that. Okay. And the final thing is the majorities are still very tight. There's a 3 to 4 Senate majority for the Republicans in the Senate. There's about a 2 to 3 person majority in the House. The recent elections went the Republicans' way, but they were close enough, and the leadership is worried enough that they actually pulled Congresswoman Stefanik's nomination for the UN because they felt they may lose that seat, and they can't afford to lose any seats. For reconciliation, what needs to be done? They need to adopt the same budget resolution. They can't have one in the House and one in the Senate and negotiate. They have to have one to go before the vote. They are also have to deal with what they call vote-a-rama, where the Senate gives time for senators to pitch any sort of bill or issue or policy that they want, and it's got to get voted on. So last time they spent about 24, 25 hours straight working on the votorama. They're probably going to have to be done again. The reconciliation should only be budget. No policy riders, you can't affect Social Security, which means you can't eliminate taxes on Social Security. You can't be doing things like that are outside the budget, like saying we are going to allow more food safety. We are going to get involved in body art. Can't do any of that. You can only do budget things. This is determined by the parliamentarian, not by elected officials. If the parliamentarian says no, then it's really the choice is we agree with the parliamentarian and move forward with that, or we fire the parliamentarian, find a new parliamentarian that might be more receptive. That might be very difficult. Finally, the fiscal year 2026 budget is going to require 60 votes. In the Senate, that means that they're going to have to do it with Democratic votes. Okay. This is what came out earlier this week. We finally got to see what the fiscal year 26 budget the proposal will look like from the administration. What happens with the budget? If you go forward and it's up to the administration to submit their budgets to say how much each agency should get, what they would recommend, and etc., and they give it to the House and the Senate. The House, all appropriations must begin in the House. It's up to the House to originally come up with the appropriations. They will come up with appropriation language. Once it passes there, it goes over to the Senate. Once it passes there, if they agree, then we finally get the fiscal year budget done. And then the president has to sign it. That's a huge step. Now, what the administration has proposed? They are proposing a dramatic reshuffling of the Health and Human Services budget. They want to create a new agency, the Administration for Healthy America. What they want to put in there is a division of environmental health. There'll be several programs within there, including mental health and other programs, but they're also going to include a division of environmental health. What is that division going to include? It's going to include ATSDR. It's going to include the National Center for Environmental Health. It'll include NIOSH, National Institute of Occupational Safety and Health. NIEHS, National Institute of Environmental Health Services. So all those programs are going to be put into a single agency. Now, last year, ATSDR got a little over 80 million. They want to cut it down to 78 million. Okay, we understand that. NCEH got about 225 million. They want to cut that down to 96 million. That means, 2/3 of the budget programs are going to have to go. And they've listed what they want to get rid of. NIOSH is getting cut. NIEHS looks the best here, getting 645 or close to 46 million. That's going to be the biggest program within this new division. Now, to create the division, can Donald Trump, the Trump administration, do it without congressional authority? Well, maybe. There are a lot of things that they can do as long as Congress doesn't call them on it. Congress is more than likely will call them on it. And it's going to be much better if Congress approves and authorizes this new agency to move forward. Now, the problem for us is when we say we would like X amount of money for lead, asthma, climate change, etc., we got no place to ask for it. In the past, we could say we'd like to have X amount of dollars in the National Center for Environmental Health. We don't have that anymore. So we're going to have to ask for it in the new Division of Environmental Health under the AEHA, which doesn't exist. We don't even know who's in charge of it and how it's going to be organized. So we have a lot of unknowns here, more unknowns than knowns. FDA, Administration for Human Foods. What this new budget is looking at is the fiscal year 26 budget. It seeks to eliminate FDA's direct role in routine food inspections of food facilities. FDA will expand the current state contracts for routine food facility inspections to cover 100% of all routine foods. HHS will submit an implementation plan that includes timeframes by the states by May 1st, 2025. The reason I put it forward that way, that is direct language from the report that's going over to Congress for fiscal year 25. They are saying no federal food safety inspections, all done by the state and locals. Fiscal year 26 will include short and long-term administrative actions to strengthen and streamline FDA's regulatory oversight of food programs, to include chemicals and other additives in food and food packagings, so they can be expeditiously removed from our food supply. That's another new issue, direct language from the proposal coming over from the White House. That's a huge shift. That's a big operation. We don't know what that's really going to mean and how they're going to implement it, but that's what the White House is requesting that Congress approve for them to do at FDA. Now, of all the FDA budget line items, number one under the Trump administration is going to be for foods. Human Foods will receive $1 billion, little over $1 billion to implement their programs. Since most of that's supposed to be going to the states, could be actually advantageous to the state and local environmental health agencies. But the total, the base allocation is going to be $2.9 billion. And with the fees, it comes to $6.5 billion. So FDA is not as in severe situation as CDC is. What the AHA, the Administration for Healthy America, they plan to eliminate several programs. The ALS program has been zeroed out. Climate and Health has been zeroed out. The Environmental and Health Outcome Tracking Network, the Tracking Network, has been zeroed out. The Childhood Lead Poisoning, that program was zeroed out. Lead Exposure Registry, that program was zeroed out. Those programs added up to about $130 million. With the elimination of that, that allows the administration to save and limit the NCEH programs to only $96 million. What they are planning to include in that $96 million is $70 million for the Environmental Health Lab. People are pretty confident that they're not going to be able to move the lab out of Atlanta. It is too much of a structure there, and it's solid. Environmental health activities, well, they want 25.6 million for that. That includes the Safe Water program at 8.6 million, and then the all other environmental health at 17 million. That's a dramatic shrinking of the environmental health, the National Center for Environmental Health budget, and their programmatic activities. So when it comes to other things that go on out there, such as PFAS in water, train derailments in West Virginia, mosquito spraying, drinking water, private wells, you go down the list, it's going to be very difficult for them to meet these demands out there. In fact, we were talking about this is the first time that CDC has been requested to do outreach to a state in this case on lead, and the CDC response has been, we can't do it. We are unable. Seeing the same thing going on with measles right now. We've got over 700 cases of measles in West Texas. CDC staff has been pulled. Very limited resources for CDC to address this. Okay, now that is what they're projecting to move forward. That's what they are going to request to Congress. What they've already done was the RIF, reduction in force. That occurred on April 1st, 2025. Not every agency was subject to the RIF at CDC, but the National Center for Environmental Health was. 2,400 positions were RIFed at CDC. That included the Division of Environmental Health Science and Practice, complete elimination of that program at the National Center for Environmental Health. The lab, like I said, was spared. Public health service officials will remain. But however, they're subject to wherever the HHS secretary wants to send them. If they want to send them to the border, they'll go to the border. If they want them to stay in Atlanta and do environmental health work, they'll do that. But we don't know what's going to really come up. That's the sanitation, big part of the National Center for Environmental Health. Right now, the program has been cut in half. They only have 12 down from 24 inspectors. That's going to really have a huge impact on vessel sanitation. If you're familiar with that issue at all, you know it's going to be very problematic when we have an outbreak on vessels. Human foods programs. The Human Foods Program is going to still keep several offices. Office of Microbiological Food Safety, Office of Food Chemical Safety, Dietary Supplements and Innovation, the Nutrition Center of Excellence. Human Foods suffered less of a reduction in force, but they're seeing a lot of retirements. People are at the end of the career. They do not want to put up with this nonsense, so they are retiring. And so the Human Foods Program is already short-staffed. We also have a freeze on hiring. So it's going to be very difficult for the FDA to perform any food safety activities. It's really going to be relying on the state and locals to make sure this all occurs. Other federal environmental health programs. As I said, FDA Human Foods Program saw a small RIF. HUD's Office of Lead-Based Paint and Healthy Housing didn't get RIFed. They haven't touched HUD yet. EPA, they haven't been RIFed. Now, rumor had it that EPA was going to get a 65% reduction in staff this week. Supposed to happen on Monday. It didn't happen. There were some pushbacks. I think the administration is learning it's a little bit more difficult to RIF people than they thought. So Administrator Zeldin is working on a reorg plan rather than a RIF, so he can shrink the size of EPA without running into the same trouble that they found over at HHS. What are going to be our priorities? We're still going to fight for the federal environmental health budgets. We're still going to fight for the National Center for Environmental Health. We're still going to fight for the FDA Human Foods Program. We're still going to support the environmental health workforce and support state, local, tribal, and territorial health agencies in the workforce. We're going to stay there. We're going to been working with our sister associations to respond to what's going on. We sent a letter from Dr. Dijak objecting to the RIF that occurred at the National Center for Environmental Health. We've reached out to several congressional offices saying we do not agree with the elimination of the National Center for Environmental Health. That is going to impact state and local environmental health programs. But we're only one voice in many. Several of our sister associations, we're all getting together and we will do a forceful march on Capitol Hill to say how this is going to impact moving forward with health, public health in this country. Now, the NEHA point of view is not that we're against the administration, the new Agency Administration for Healthy America. That could improve things. We're not upset. I can't say upset, but we're not objecting the move from NCEH and ATSGR over to this new division. We are confused about how that will impact us, and we want to make sure Congress knows how important these programs that were funded by NCEH and supported by NCEH are to the state and local environmental health agencies. We want to make sure we're not going to be quiet on this, but it's something that is a huge change. From when we talked a month ago, dramatic things have occurred. A month ago, the National Center for Environmental Health was fully staffed. A month ago, the National Center for Environmental Health was not eliminated. The ATSGR was not going to be moved. Human Foods was going through a reorg at FDA. Now they're going to go through another reorg and another new way of providing for food safety. What we're seeing from the administration is that there's a conscious support for food safety. They acknowledge that food safety is an important part of keeping America healthy. They're also making conscious statements about where they feel about the National Center for Environmental Health, climate change, lead, asthma programs. They do not support them, and they've zeroed them out. The ones that they are supporting are ones that deal with water, wastewater, things, the lab. These are things that they will continue to support. And that's the reason that they think to meet their mission, what they're trying to get done, it's going to be better to create a new division over at this new agency, which hasn't been created yet. Other programs at CDC, Injury Center, it's gone. The National EZID, well, let me talk about ASPR. ASPR has been eliminated. The Public Preparedness Office has been eliminated. The enteric and zoonotic and infectious diseases, that was spared. And in fact, they include 76 million for food safety in that center. They're also adding a new $26 million, one of the few additions that the administration is talking about to study wastewater. That's going to be in the Center for EZID. So it's not universal. We haven't seen every part of environmental health pulled and moved to this new division, but there are going to be many important elements of environmental health that are getting moved over to the new to this new division. Before I go on, Heather, do we have any questions?
Yes, we do have one question. That's from Michelle Samaritan. If a state chooses to keep a congressional seat vacant, doesn't that keep constituents unrepresented? And how is that legal?
Okay. There are two ways you fill a seat. One, if it's a senator, the governor gets to appoint whoever she wants. If it's a House seat, there are legal timelines that the governor has to call for a special election within a certain time. That special election, it's up to the parties to put forth candidates, and they get elected. They cannot simply not fill the seat. They have certain timelines that they need to follow. Now, there's always caveats to that. That's, for whatever reason, a state may have some sort of exemptions there, but every state has a procedure to fill a congressional seat. When they become open, it must be the congressional seats, the House seats must be elected. Senate seats can be appointed, House seats can be elected. And that's how it's legal.
Thank you. I have another question.
Sure.
How is all of this going to affect food safety?
Like I said, it's getting food safety has been very interesting under this administration. Whereas climate and health is gone, there's no support within this administration for that. Food safety is different. I do believe that Robert Kennedy truly believes that what you eat is going to have an impact on your health. And he has a strong agenda item to make food safety, to make food healthier. What's that going to mean? Well, one thing we're seeing immediately is that the funding that state and locals were losing under Jim Jones and the previous administration, looks like that money's coming back. They have said in this fiscal year 26 report that they want 100% of all food safety facility inspections to be done by the state and locals. That means that they're going to have to amp up the money going to state and locals to pay for all these inspections. This isn't something that you can just say is going to happen. It's something that has to happen within a budget. They're going to have money for it. The other thing is what they're looking at. Something that we didn't ever talk about before was chemicals in our food supply. Robert Kennedy is specifically talking about that. He has real concerns. Some are legitimate, some are less so. But these concerns are real, and it is going to mean that FDA, Human Foods, is going to invest more money and more resources towards chemicals going into food. What chemicals are allowed, which ones are not allowed. Which anybody who's been involved with food safety regulation knows that's a huge burden to address. And it's going to have to come from the manufactured sector saying you can't put this stuff in, which means you're going to get very, very involved with the retail food system. He's also very concerned about nutrition and processed food. If you remember, 8 years ago, 9 years ago, 10 years ago, Michelle Obama made the outrageous claim that kids should have apples in their school lunch program, and she got lambasted. Now Robert Kennedy is saying, I want no processed food in the school lunch programs. School lunch programs are funded by the federal government, by USDA, not HHS. But making that claim in and of itself could throw the entire school lunch industry on its head. And this administration has been more than willing to throw any sector of the economy on its head, including school lunches. So I could see some dramatic changes, but I don't in the FDA Human Foods Program, even in the CDC Human Foods Program that's going to be at Easy ID. And I don't see it all being bad. We could see some real benefits from this and some things that are really going to support the state and local programs. Anything else, Heather?
Just a follow-up to that, how is this all going to affect the National Center for Environmental Health?
If the administration has its way, the center will be eliminated. And if you're getting funding for lead or for asthma or for climate and health, that funding will be eliminated. Now, some of you may say out there, wait a second, Congress has authorized these programs and they provided money for it. They specifically said that CDC shall have a lead poisoning prevention program, and here's the funding for it. What authority does the administration have to eliminate it? Well, that's a big question out there. And I can assure you that there'll be a lawsuit over that if they do seek it. However, if Congress goes forward and agrees with what the administration said, zeroes out lead, zeroes out asthma zeroes out, climate change, good chance that those programs will be eliminated. We do not know. We are trying to get information, and I'm working diligently on getting information about how this new administration on Healthy America will look. It's going to be in charge of the Division of Environmental Health. We don't know. Anything else?
All right. No, that is it for today. I'm not seeing anything else.
Okay, I want to go over a couple of QR codes before you guys hang up. Take a look at this. If you get the chance, take a look at this. We've got a great comic series out there that one of our staff did. This is one of the best, I don't even know what to call it, but one of the best materials, products out there, talking about how to deal with and how to work and engage with the environment, with the policymaking community. The QR code here will direct you right to it. Please take a look at that. It's a good way to contact and discuss policy with your policymakers. We've had this around for several years. I want to highlight it. Also, if you have concerns about the funding of the National Center for Environmental Health or its elimination, click on this code. You'll be able to send a message directly to your congressional delegation, your congressperson, and both your senators, where you can say, as a U.S. citizen, not as an environmental health professional and not on behalf of NEHA, but as a U.S. citizen, I have these concerns. And they'll go directly to your congressional delegation. If you have concerns about the FDA Human Foods Program, anything I said today, anything you've seen in the past, again, you will have the opportunity to send these messages directly to your congressman. I highly recommend you do this. These are the QR codes. You can go online to the NEHA page, go under advocacy. You can tell your lawmakers that way too. Same program. But this makes it super simple to do. I highly recommend you doing that. NEHA, don't forget, take a look at what we're doing for you. What's going on out there in the workforce? How we are trying our best to make your lives better every day. Finally, don't forget, we'll be in Phoenix this summer. Please sign up for the AEC. The registration is open. We are going to have a great show for you. With any luck, we're going to actually have FDA there to explain to you what's going on. And if we are really lucky, we'll have people from the Division of Environmental Health at the AHA there to explain what their plans are. With that, I want to say thank you very much. And thank you, Heather, for moderating this session today. I hope you all have a good week, good month. I bet you we're going to have a lot more to talk about next month.
Thank you, Doug. Thanks, everyone. See you next month.
Thanks. Take care.